Hello, this is Kendrick with worldmedicalschool.org. Today we're going to talk about postoperative complications. Really, I just wanted to talk about post-op fever, but I'm going to mention some of the others here too because they are important. So post-op fever is one of the most important things to manage, and then we have nausea and vomiting, which is the most common postoperative complication. You also have respiratory problems that are a big issue in the post-op period, cardiovascular complications, altered state of consciousness, and urinary retention. We'll go over a few of these. So post-op fever, this is what I really wanted to get at. So the causes, we usually have that acronym: wind, water, wounds, walking, and wonder drugs. And that's a good acronym, or it's a good mnemonic, I mean. But one of the things that we've talked about in the past, or that we've used in the past, is not accurate anymore. So atelectasis is one of the first things we usually think of when we think of post-op fever. And that has recently been kind of shut down as a reason for post-op fever. They don't think it causes fever at all. And even on the up-to-date page for post-op complications, it still said atelectasis. But if you went to the post-op fever page, then they said atelectasis is no longer thought to be a cause. And I think I have a link to a study that you can look at the end, so you can verify that. But so wind stands for pneumonia or pulmonary embolism, water, UTI. Wounds, inflammation, just from a surgical site, is now probably thought to be the most common reason of post-op fever, especially early post-operative fever, which that's the category that we used to attribute mostly to atelectasis. So inflammation, just from the wound, is probably the most common cause of post-op fever. Infected wounds or abscesses are also a cause. Usually those will show up a little bit later. The fever will show up a little bit later. DVTs, of course, show up, but those are usually a couple of days later, a few days later. And then we got our wonder drugs. Antibiotics, heparin, and diuretics are the most common drugs that cause post-op fever, but there's actually lots that do. Then there's also a malignant hyperthermia. I don't know if anybody remembers this story, but a few years ago, a cheerleader died in a surgical center because she had a malignant hyperthermia. And it's caused by a certain genetic mutation that makes people unable to tolerate anesthetic gases. So this young lady, unfortunately, was in for a breast reconstruction, and she died in the surgical center because they didn't have the antidote to this, which is dantrolene. So then we also have wonky thyroid or adrenals. Hope you don't mind that I threw that in there, because we can get thyroid storm, and you can also get adrenal crisis after surgery. So those are things that may be on your differential. So the treatment of post-op fever, first of all, you just want to remove any unnecessary treatment. So if they try and get them get their catheters out and things like that, remove any drugs that they're getting that they don't necessarily need right now, and then we want to what does BS antibiotics in unstable mean? BS antibiotics in unstable. Shoot, I'm sorry, I don't even remember what my own okay, I can't remember. So you give broad spectrum give broad spectrum antibiotics if somebody's unstable, and and then you DC those antibiotics after 48 hours if no cause. So you get your cultures if you think things need to be cultured, and then you give them broad spectrum antibiotics. And then if you don't ever see a cause of the fever, then you take them off the antibiotics. Of course, if they're stable and you don't have a cause of infection, don't put them on antibiotics because you don't know what you're treating. Postoperative nausea and vomiting. This is actually, somebody did a study saying that this is the most feared surgical complication. People are really worried about how they're going to feel afterwards because nausea and vomiting is so common. And the main risk factors are young females, people who get motion sickness, people who don't smoke. So if you are not a smoker, it's a good time to start. I'm just kidding. Obviously, smoking has a lot more negative effects, but this one is not one. Prior post-operative nausea and vomiting are all risk factors, so you might want to do prophylaxis with like a 5-HT3 inhibitor, like ondansetron or any of the other cetrons. Scopolamine is also useful. You usually get this in a patch. Others that dexamethasone I hadn't actually heard of, but I guess that's used. Metoclopramide and droperidol are also others. Respiratory complications. There's a few different reasons why you might have problems breathing after this. Airway obstruction. So the anesthetics and the muscle relaxants may cause pharyngeal laxity, which makes it harder to breathe. Also, you can have edema, especially if the surgery was anywhere near the neck. You can also have a decreased respiratory drive from the opioids and sedatives, so you might need to give Narcan or flumazenil for the benzodiazepines. Of course, neuromuscular blockade can cause a decreased respiratory drive. Also, if people are in a lot of pain, if it's a thoracic surgery and it hurts to breathe, they may not get enough air. Decreased gas exchange can be caused by atelectasis. This is a real cause. Atelectasis does do something. And pulmonary embolisms, which again usually will show up later, but you can also get fat embolisms directly from surgery. Some cardiovascular complications. This is too big of a subject for me to cover here, but you can get arrhythmias. You can get hypotension either from sepsis if they have a prior infection, or hypovolemia if they've lost a lot of blood. Hypertension also is a possibility. The pain, the anxiety, urinary retention, which we'll talk about in a second, and drug withdrawal. If they're on drugs and they've been off for the preoperative and postoperative period, they might go into withdrawal. Urinary retention. You can get kind of a mechanical urinary retention if the procedure was done around the pelvic area. Also, you can get anesthesia-related urinary retention. So to diagnose this, they recommend, the article I read recommends doing the ultrasound first and figuring out what's going on, and then you can drain the bladder, just because you might be causing damage if you're trying to drain a bladder that really is not holding urine. But it sounds like a lot of people will put a catheter in if there's urinary retention first. So I don't know what, sounds like the recommendation would be do ultrasound first. So this is the article I was talking about, atelectasis as a cause of postoperative fever. You can look that up. It was in Chest in 2011. And if you want to get involved in this project, you can leave a comment below to help us make our videos better. And you can also go to worldmedicalschool.org/volunteer, and there's lots of great ways that you can be involved. Thanks.